I'm Megan with Train with Trust Project. And of course, I'm joined with Jody Ambrose, who is another co-founder along with me of the Train with Trust Project. We're a nonprofit dedicated to making sure that equine behavior education is accessible and to promoting the use of evidence-based training practices. And we're again so happy to have Dr. Sue Dyson joining us, the world-renowned equine orthopedist, familiar to most of you from her appearance in the documentary short film, The 24 Behaviors of the Ridden Horse in Pain, Shifting the Paradigm of How We See Lameness. That film is available on YouTube for free for any of you who haven't seen it. And we at Train with Trust Project are really excited about today's topic. It is such a great example of one of our guiding principles at the Train with Trust Project, which is to continually view animal behavior through a holistic framework. When we're evaluating behavior problems ourselves, we are always dealing with a whole scenario, not just part of a horse, not just one piece of equipment versus another, but a whole horse and rider combination, plus the entire environment they are both interacting with, including the choice of tack. And in the case of today's discussion, the choice of using a bit or not using a bit. So with that being said, I'm going to turn things over to Jody, who's going to set the context and begin our discussion with Dr. Dyson. I'll be in the background fielding your questions that we can give to Dr. Dyson during today's discussion. So thanks for joining us, and I'll turn it over to Jody now.
Hi, everybody. And as always, thank you, Dr. Dyson, for joining us. We're really lucky to have this opportunity to get your perspective on all of these issues that everybody is interested in. I'm just going to talk a little bit about my perspective, and then I will give Dr. Dyson the floor. Coming up, I was basically taught that a bit is only as harsh as the hands of the rider holding the reins. And while there's, an element of truth to that, I think we all know now that it's a lot more complicated than that. As a trainer, I don't just assume that my choice of equipment doesn't matter because I have quiet hands. That I can't let my ego or assumptions based on my experience make that decision. I need a way to judge and measure how a horse is responding to any particular thing that I do, and not just rely on feelings or beliefs, which I think is a lot of times how it feels we're supposed to make those decisions. So we need a way to come up with evidence that supports our choices. And those would be choices for our own horses, and also the choices that we make when we set policy for different horse sports, different equestrian activities too, which is obviously a hot topic right now. So that's really where this connects so perfectly with Dr. Dyson's research and the 24 behaviors, the ridden horse pain ethogram, because it gives us criteria based on science that we can use to evaluate what's going on with a horse when it's being ridden. So specifically, that can really help us evaluate the equipment that we choose. For those of you who are familiar with the 24 behaviors through the film or through the many articles and speeches and podcasts and everything that have been done on it, if a horse has 8 or more of the 24 behaviors, there's a high likelihood that that horse is experiencing musculoskeletal pain. But if it has fewer than 8, there's all kinds of each individual behavior can have all kinds of causes. We know in the film when they adjusted saddle fit on Galena, it did reduce some of the behaviors. So what we're talking about today is how to evaluate not just saddle fit in that way, but also what you're choosing to use, whether it's a bit or a bitless bridle. The one exception I'm going to make before we get into this is that there is some overlap between talking about bitless bridles and talking about nose bands. And Dr. Dyson could give a whole master's level course on on each of these topics. So we're going to try and stick with the topic of bits and bitless bridles specifically. And in the future, we will definitely do a conversation on nosebands, or find out what you guys want to know and figure out a way to get that information to you as well. So for today, if you have questions about nosebands, we may not get to those. We'll save those for another day. Having said that, even just focusing on bits and bitless bridles, there's a whole lot that we can discuss, and not very much time. So I'm going to give the floor to Dr. Dyson and ask, initially, I'm just going to ask, is there evidence that suggests that bitless bridles or hackamores are less likely to cause discomfort than a bit?
Well, there's a lot of anecdotal information, but in terms of evidence-based information, there is really remarkably little. There have been a number of surveys done in a variety of European countries, which have looked at the frequency of occurrence of lesions or damage within the mouth that might be attributable to a bit. So, for example, cracks in the corner of the horse's mouth, or lesions of the bars of the mouth that may have been created by pressure from the bit. And the frequency of occurrence has varied hugely depending upon the country in which the study was performed, the discipline with which the horse was involved with, and also the types of bits that were used. But there was no direct comparison between bits and bitless. But one would assume that these types of lesions would not occur with a bitless bridle. However, there are a small number of studies which have compared the use of a bitless bridle versus a one with a bit, and looked at the pressure under the noseband or the nose piece of the bitless bridle and various kinematic parameters, that is, how the horse is moving. So there was a small study involving 5 horses when they compared the use of a snaffle bridle with a cavesson noseband and the use of a side pull bitless bridle and a cross under bitless bridle. And these were used for short periods of time on each horse. Pressures under the noseband were measured, pressures under the headpiece were measured, and the degree of carpal flexion and the degree of tarsal flexion, that's the hock flexion, and the angle between the head and the neck were measured. The pressures under the nose piece were substantially more for the side pull bitless bridle and was sufficient to cause potentially tissue damage. With the cross under bitless bridle, the angle between the head and the neck was greater than with the snaffle bridle, and this may have implications for movement of the back and therefore also engagement of the hind limbs. So that angle between the head and neck was slightly larger than with the bit, which may result in increased movement through the back, although that was not specifically measured. There was another study done with 2 naive horses in each group, and 2 naive horses used one of Dr. Cook's bitless bridles, and the other 2 used a Fulmer snaffle, and their behaviors were observed during tacking up, mounting, during long reining, and during ridden exercise. And not surprisingly, when the 2 horses which had the bit in their mouth were tacked up, they had more chewing behavior. But remember, these horses had never had a bit in their mouths before. And with the bitless bridle, when they were long reined, the horses lowered their heads and neck more. But they didn't compare each horse with each type of bridle. They just took 2 naive horses, 2 of which had the bitless bridle and 2 had the snaffle bridle. So really, you can't really conclude anything from this. So the level of evidence is tiny. Tiny.
Interesting. So we're talking about bitless bridles, but I guess before we even consider that, we should talk about bits themselves. Is there evidence that bits are, that there's a reason that we need something better than bits? We've been using them for thousands of years, and you know, if it ain't broke, don't fix it. Is it broke? Is there evidence that they cause discomfort to horses in general? And if so, what's the prevalence of that?
Well, those are good questions. I've already talked about the lesions in the horse's mouth, which
Right.
must have been caused by the bit, but we don't know how much the bit per se was the cause, rather than how the horse was ridden. So you can't isolate the bit from the horse itself and from the pressure applied by the rider via the reins. They are a complex triad, and to tease out which is causing what is rather difficult. For example, we know that many horses which have lameness will pull the bit through to one side of their mouth and cause therefore more pressure on that side of the corners of the mouth than on the opposite side. If you take away their lameness through the use of nerve blocks, then they immediately take a more even rein contact. So you could say, well, you could look at it from the other way around, and you could say, well, why was there uneven rein contact? But that was created by the horse. It wasn't created directly because the bit was in its mouth. We did another study when we looked at horses that were presented for clinical investigation, and they were observed moving on the lunge, wearing their normal tack. And we looked at the frequency of occurrence of mouth opening. And then those same horses were evaluated during ridden exercise, and the frequency of occurrence of mouth opening was recorded. And those horses that were being ridden showed much greater frequency of mouth opening than the same horses in the same tack on the lunge, which would indicate that it's something to do with the effect of being ridden. Whether it's the rider or the weight on the back or whatever, something is causing the mouth to be opening more. There was another selection of studies that we did when we looked at the performance of horses either warming up for the dressage phase of a 3-day event or a 1-day event, or during competition at Grand Prix level dressage. And one of the behaviors of the ridden horse painethogram is the mouth opening with separation of the teeth for 10 seconds or more. So when we looked at the proportion of horses that showed this behavior at the low level eventing, so British eventing 90, 100 and novice, so they're jumping 90 centimeters, 100 centimeters and 1 meter 10, and all of those horses were using snaffle bridles, the frequency of occurrence of mouth opening was only 35%. At 5-star 3-day events, it was 44%. A small proportion of those horses would have been ridden in double bridles. But when we go to Grand Prix dressage, at World Cup level, the frequency of occurrence was 68%, and at sub-elite Grand Prix level, it was 81%.
Wow.
And so what's the big difference there? The big difference is a double bridle, because it's compulsory to use a double bridle at Grand Prix level. Now, one could also say maybe the riders were being somewhat more coercive in their application of their cues, but here we have a substantial difference between upper level dressage, mouth opening, and double bridles. We can't say it's necessarily cause and effect. It could be due to the rider, but
it's a pretty big differential. Yeah, interesting. And that's in a sport where it's actually being judged. So I guess, does that suggest that it's not being penalized by the judges?
I think one has to assume that. I mean, if 81% of sub-elite horses have got their mouth open for at least 10 seconds or more during the test, and many of them it would be much more for a much longer period of time, and acceptance of the bit is one of the criteria of judging,
right?
I must conclude that if some of these horses are scoring 70% plus, then that cannot be taken adequately into account. which I suspect is because the judges are not looking specifically. They're looking at the overall picture of the horse, and they're not looking at specific elements.
Right. So you've mentioned mouth opening as an indication of discomfort. Is it always an indication of discomfort in your opinion?
Well, one could say that there are many potential reasons why the mouth might be opening. So we're putting two bits, for example, into a horse's mouth, or a single bit. There is the assumption that the bit is going to fit the horse, but does it fit the horse?
Mhm.
How many people individually fit the bit to their horse's mouth? Or do they just take which bridle is hanging in the tack room and say, well, this will do for Fred? How many people have a loriner, a bit fitter, to come and assist with bit fit for their horse? Not very many, I don't
No,
think.
I don't. In the US, I don't know that that is even a thing.
So I'm not sure that bit fit is particularly taken into account. Horses vary in their head shapes and the head size and the size of the oral cavity and the size of the tongue. And the external characteristics of the head don't necessarily marry together with the internal characteristics of the mouth. So you can't just say, well, this is a cob, we're going to put a cob-sized bit in the horse's mouth. That might not be appropriate. And then the horse may open its mouth because the rider is effectively balancing on the reins because their core strength and stability is not sufficient. So they're using the reins in part to balance themselves. And obviously the horse may open its mouth in protest at that. So I think that there are potentially many reasons why horses might open their mouths. And there was a study, again using Grand Prix horses which were ridden on a treadmill by their normal rider. And they showed that in synchrony with the sitting trot, many of these riders had rhythmic, slightly backwards and upwards movements of their hands. And in synchrony with that, they could see separation of the lips of the horse. So the effect of the rider cannot be ignored.
Absolutely not. Yeah. And so going back to talking about the differences in anatomy of different horses, that sort of undercuts the assumptions that I was always taught that I think are still fairly common, that a thinner bit is harsher than a thicker bit, and that a jointed bit is harsher than an unjointed bit. It sounds like the horse's anatomy might come into play when you're making the decisions between bits. Is that right?
Yeah, I think that's certainly the case. And one always has to say, well, for example, I can remember as a cross-country rider having a very strong horse. It was a very good horse. It was very strong in an egbert jointed snaffle. And so I therefore switched to a vulcanite pelham, and the horse then was much, much more controllable. So yes, I've got a straight bar effectively, but the influence on the horse with a much lighter rein cue was profound.
Mm-hmm.
So for me, I was being kinder to the horse by using a bit to which it was more responsive. So I think that one has to individualize the bit to the horse and how it responds to the bit, potentially.
Right. And that goes back to using behavior, the horse's behavior, in a methodical way to evaluate, which I think is the piece that that I have never felt that I had at my, at my fingertips, to be able to like use something like an ethogram to evaluate the difference between one bit or another, or bit and bitless. So that's I think what's so interesting about looking at it from this perspective. And we don't want to, as I said, we're not going to get into nose bands today, but what about the way the bit is adjusted on the bridle? These days I see a lot of people putting the bit much lower in the horse's mouth than it used, it used to be the wrinkles, and now I see some horses that have no wrinkles. Have there been any studies on that, or do you have an opinion on that?
There have been no studies. I certainly have an opinion because I've seen too many horses which have been presented for clinical investigation, and the bit has been far too low in the horse's mouth. It's banged on the horse's tushes if it was a male horse. And you can see the horses trying to hold up the bit with their lips because they don't want it too low down. So to me, the conventional way that I was taught was that if you hold down the bit rings on each side, there should be no wrinkles to the corners of the lips. But if you don't pull down on the bit, there should be a slight wrinkle. And to me, that works most effectively. But there's actually no evidence base for that. But I can say that I have seen damage to the bars of the mouth and wear marks on the tushes if the bit was too low.
Yeah, it'd be nice to have some evidence on that, because I feel like somebody sees one person do it and then it spreads like wildfire, and you see a lot of people doing it and they don't know why they're doing it. They're just doing it because they saw someone else doing it. So it'd be nice if we could get some empirical evidence on that. So we talked about mouth opening. You talked about the bit sliding through the mouth. Those are both behaviors on the ridden horse pain ethogram. Can you talk just a little bit about some of the other behaviors that people might focus on if they're looking to evaluate whether their bit choice is correct? I know all of them probably could be related, but are there some that you see specifically that changing a bit might have an effect on?
Well, I always think about, why is a horse lolling its tongue? Why is a tongue moving in and out? Now, there have been some other studies which show that this may be a stress-related behavior. Whether it is directly related to the bit, I don't think we know. But certainly, if I was presented with a horse for investigation and we observed that the tongue kept coming in and out, once I had resolved any other underlying problems, I would certainly want to address the bit fit for that horse's mouth relative to the size of that horse's tongue, and to see if I could provide a more comfortable environment. I don't know specifically that the tongue coming out is due to the bit, but I think it's something that needs to be looked at in each individual horse. I think we could comment about the fact that there are various other behaviors that may or may not be related to the bit. So, for example, is teeth grinding related to the bit?
That's a great one, because that one's not on the ethogram, but that's such a common one.
Yeah, and my impression is teeth grinding is a stress-induced behavior.
Yeah.
Sometimes that stress is induced by musculoskeletal pain. There is no reason to assume that it couldn't be caused by discomfort in the mouth. And certainly if there were cracks in the commissures of the mouth, or buccal ulceration, that ulceration on the side of the cheek due to sharp teeth, then we would need to address that. And that's another thing that I think we always need to consider when we're talking about comfort within the mouth, that we cannot ignore the fact that routine dental care is absolutely crucial. And we tend to jump in and say, well, the horse is not accepting the bit because it's either the bit is wrong or the noseband is wrong or something, without thinking, well, is there something obvious, such as sharp outside edges to the upper cheek teeth, creating ulceration of the inside of the cheek? And that can have a profound effect on a horse's head carriage and acceptance of the rein cues. And so therefore, I would advocate that regular dental assessment and routine treatment are essential.
Yeah, absolutely. Because we were just talking about this the other day, that's usually the only time that anyone actually looks inside the mouth. When you consider, things like oral lesions, there's a lot that can go on that we don't even see. And we were talking about in zoo settings, they actually train the animals to present an open mouth so that you can look, and we know how to train that. So that's a behavior that maybe we should encourage people to learn how to do, so people can look in there. But related to what you just said about the dental care, is that equally important if you're riding bitless?
Absolutely, yes, absolutely. Because even if you're bitless, you've got something constricting around the nose, and that constriction is going to create pressure of the cheeks of the horse against the cheek teeth. And so absolutely, it's of paramount importance.
That's a
without a
great
doubt.
point. That's a great point. So I'll get into some of the questions that were submitted ahead of time. Someone asked if you could talk specifically about the cross under bitless bridles. She said that she's heard a lot of conflicting information and would love to know if you have an opinion about that type of function.
Well, I've reported to you already the only scientific studies that have been done, which are limited in their applicability, I think. And so I don't think there's sufficient evidence from a scientific point of view to say that it is preferable over any other form of bitless bridle or hackamore. I have no personal experience of riding in such a bridle, so I can't comment from that perspective.
So we had another question that may sort of fall under the same category, which is that if you have a pony that bolts and goes dead in the mouth or one side of the mouth, would that be a candidate for a bitless bridle? And obviously that's a training question, I think, as much as a veterinary question, but can you speak to in terms of the use of the bit to deal with that sort of behavior?
Well, I think absolutely we've got to, first of all, define why is the horse bolting? Was there some pain-induced problem that the horse wants to run away from, in which case we need to identify that? Or was there some historical event that encouraged the horse to bolt and it's now become learned behavior? Or was there a combination thereof? So we have to retrain the horse to respond to the bit, so that we have to, or a bitless bridle. I don't think it matters which it is, as long as the horse is trained such that it knows when a cue is applied and the horse responds in the appropriate way, there is immediate release of pressure, because that's how they learn.
Right.
And I don't think that it's going to matter whether it's using a bitless bridle or a bit. It's just a question of the horse learning that this cue means stop.
Yeah. And I will add in there, as a trainer and as a behavior consultant, if a horse has things that are causing them anxiety, those things can stack on top of each other. So bolting often is a behavior that happens when more than one thing more than one cause is happening at the same time, or the anxiety level is already heightened when something happens and pushes them over the top. And with the other piece of that question, with the mouth going dead, when those triggers stack and you get to a certain level of anxiety, learning stops and information stops getting through. And so that deadening in the mouth might be less of a physical manifestation and more of a psychological manifestation of the overall level of anxiety, and doing multiple things to bring that anxiety level down, which could involve fixing pain for sure, often does, but other things in the environment that might be easier to adjust as opposed to the horse itself might actually be effective to get more response in the mouth. So there's a lot of different ways to look at that question. It's really interesting. Let me look. So I think there was another similar set of questions. Someone asked if if one of the purposes of the bit is to relax the jaw, can that be accomplished with a bitless bridle?
The equestrian world has some rather strange jargon, I think, and I say this both as a rider and as a veterinarian. So I would say, how do we define relaxing the jaw? It's just like the FEI rule guidelines for dressage saying suppleness of the pole. Again, what does that actually mean?
Nobody knows.
We, from a rider's perspective, want the horse to be responsive and obedient to our cues. So we want the horse to be going straight. We want to be able to stop and start as we ask it to do so, and want to do that without a fight. So if I'm applying a rein cue, I want the horse to respond by slowing down. And I don't want the horse to pull against me. Now, if that's what a relaxed jaw means, that's as close as I can get. And I don't see why, if the horse is comfortable in its mouth, whether the use of an appropriate bit would be inferior to the use of a bitless bridle. We just don't know. Because as I said, many of these bitless bridles create a huge amount of pressure across the nose. And they have to be correctly fitted as well, because if they are fitted too low, then you get compression of the soft tissues of the nostrils, and you can potentially impair their breathing capacity. So it's not as simple as saying bitless and a bit. It all depends upon the fitting, and it all depends upon how the rider applies their cues and how the horse has been trained to respond to those cues.
So there's a lot of factors that that have to be addressed. And actually, I think we could probably have a whole conversation on that sort of jargon and discussing what the actual meaning of some of these words are and whether we can use our language more precisely. I think a lot of the conflict and controversy probably comes from people defining words differently. So that's actually a great topic for another day. The same person asked about a poorly fitted bit blocking a hind leg. Is that, does that mechanically make sense to you as an orthopedist, or is that more jargon?
I don't think we can necessarily say the bit, but if, for example, the horse is ridden such that the head is behind the vertical, which is often achieved via the rein cues, then if the head is behind the vertical, the horse biomechanically will be affected in the rest of the body. So it will be more difficult for it to engage the muscles of the thoracic sling. It will have reduced range of motion of the back, and therefore will have greater difficulty in engaging the hind limbs. So used inappropriately and with an inappropriate training, then yes, the bit can influence engagement of the hind limbs. But that same bit could be used by a better rider who rode forwards more and didn't create the position of head behind vertical, and the horse would move differently throughout its entire body. So it depends how the cues are applied by the rider.
Okay, so I think that's actually a great answer to that. I think many different people would interpret that differently, and you broke that down in a way that I think would make sense to anybody. So that's all the pre-submitted questions. I think we have, I would like to know, do you think that bitless bridles should be allowed in competition? Because that's a topic that has been at the forefront recently.
Well, I think that depends what sort of competition you're talking about. So if the horse is doing show jumping or cross country, when you're looking at its performance of clearing fences, not stopping, for example, then I see no reason why you shouldn't allow a bitless bridle. If you are performing a dressage test and you're saying, well, can we judge equally the horse with a bit in its mouth and not a bit in its mouth? I think it becomes a little bit more difficult, because unless the rules are changed in the guidance and saying, is there acceptance of the bit?
Mm-hmm.
If you took that out and just looked at head and neck posture, facial expression, and the way in which the horse was moving and the way it responded to the cues, then I see no reason not to have bitless versus a bit in the same competition. But it would require a change in the guidelines to the judges.
Interesting. And so you're coming at this from a perspective of how to judge it. And from everything you've said, it sounds like, at least based on the evidence we have, there's not a strong, compelling reason to encourage that rule change.
Well, I don't think we have sufficient evidence to say that bitless is more welfare friendly than a bit.
Okay.
it is largely a question of personal choice. And I've ridden horses in hackamores who when they had lesions in their mouths, which were because they'd been pulling too strongly against a bit. And I felt you had to be extremely careful and delicate with your hand cues, because in fact, the hackamore, a bitless bridle, can be potentially pretty severe.
Right.
So I think this whole debate has so many different avenues down which you could discuss. And it's not just as simple as just saying bitless is good and bitless are bad.
Yeah, and that leads me to the other question that I was going to ask, which is, as a researcher, what do you feel what are the questions that we need to answer? What would be your wish list for?
Well, I think if we're going to look at this in a properly conducted scientific way, you have to take a group of, say, at least 50 horses and test them being ridden in a bitless and in a bitted bridle, both of which were fitted appropriately. Now, each horse would have to have some acclimatization process, because if the horse had never been ridden in a bitless bridle before, it's not fair to judge that just on a single occasion versus if the horse has been ridden in a bitted bridle all the time. So this would be a fairly complex study to do, because you've got to have a rider who is riding the horse in the same way. Can you disguise to the rider which they've got, a bitted or a bitless bridle? How do you make the judgment? What are you actually judging? Are you judging mouth opening? Are you judging head posture? Are you judging the way in which the horse moves? I think it's not going to be an easy study to perform, but obviously requires some objectivity in terms of measurements that need to be acquired. You could look at rein tension, but the devices that measure rein tension are full of mechanical problems in terms of their repeatability and their use. So this is a tough question to answer simply.
Which is why we're talking about it. Did you have something
to you? Yeah, as I'm listening to that and the rest of the discussion, what occurs to me, particularly with that, what should we be studying? The research that you've done has been able to give a lot of input about when horses are experiencing discomfort, at least musculoskeletal pain, and using the 24 behaviors and perhaps other behaviors to inform us as to how horses are feeling. In essence, listening to their behavior and say, is there a way that we can look at the equipment that we do have and assess when is the horse doing well? One of the conversations we've been wanting to have, and we've discussed with you before on our own, is about helping folks recognize, what does a happy horse look like? What can we look at and say, this seems to indicate that this horse is having good well-being right now, and maybe looking at that more carefully with bits, equipment that we have used for a long time, and then we might have some better way to compare the two. But really, really a great jumping off point for lots of discussion and further thoughts about the matter, I'm sure. With that, without going down other rabbit holes of discussion, we'll go ahead and leave this one for today. Again, if you all do have some topics that you would like us to discuss, please be sure to comment to us on our social media, or in the comments for the events on this page. In terms of using the ridden horse pain ethogram, which is again specifically designed with musculoskeletal pain in mind, but to get a good look at those behaviors and things that you might be able to evaluate with your horse regarding their level of comfort, be sure to go to 24horsebehaviors.org and you can download the mobile field guide to the 24 behaviors of the ridden horse pain ethogram there. These videos will be posted if you came in partway through, or as we were having a little bit of technical difficulties, if you were not able to view it live, you can view the video on our blog at the 24horsebehaviors.org.
Not the, it's just 24 horse behaviors,
24 horse behaviors.
not the.
Yes, sorry, 24horsebehaviors.org. That the 24horsebehaviors.org website, but if you want to find 24horsebehaviors.org. Also, we have our content on the trainwithtrustproject.org, and just be in touch with us if there's more you'd like to see. And thanks so much for joining us.
Thank you, Dr. Dyson.
Thanks, Dr.
You're very welcome.